the reproductive health and adolescents community health REACH webinar series. Before we begin this evening, please allow me to just remind you or share with you a few housekeeping reminders. First, the session is being recorded. You may submit your questions at any time using the Q&A or the chat feature. We will address as many questions as time will permit. Kindly keep your microphones muted unless you are invited to speak. We encourage also that you participate actively in any polls, discussion, or activities facilitated during the session. And to those who participated in our previous webinars, thank you for returning and for continuing this important journey with us. Your presence demonstrates your commitment to learning, collaboration, and improving the health and well-being of our adolescents across the OECS. To those joining the REACH webinar series, for the first time this evening, we extend a warm welcome to you. We are delighted to have you with us, and we hope that tonight's session will be informative, engaging, and beneficial to your work with adolescents and young people. Now, just to share with you a little bit about the REACH project. So the REACH project, it's a regional initiative aimed at strengthening adolescent health by promoting meaningful youth engagement, improving access to quality adolescent-friendly health services, and ensuring that young people have a voice in shaping the programs and the policies that affects their lives. The project is being implemented in St. Vincent, St. Lucia, Grenada, and St. Vincent and the Grenadines. Through this webinar series, we are creating a space to learn, exchange experiences, and explore practical evidence-based approaches that can contribute to healthier and more supportive environments for adolescents throughout the region. And so at this time, it is my pleasure to welcome and to introduce our facilitator for this evening's session, Mrs. Maxine Blake Ilton. Now, Mrs. Blake Ilton is a licensed counseling and consultant psychologist with a master's degree, whose work reflects a deep commitment to emotional well-being, healing, and personal growth. She is a certified grief and trauma therapist and a play therapist, bringing specialized expertise to individuals and families navigating life experiences. In her role as program manager at the Caribbean Technical Assistance and Education Center for Health, she contributes to strengthening health system in the Caribbean region. With more than 20 years of service as a public health practitioner, Mrs. Blake Hilton champions a holistic approach to health, one that recognizes the total well-being of the individual and the vital role of the support system around them. She's also currently pursuing a Doctor of Psychology degree. And so at this time, help me to welcome again our facilitator for this evening's webinar, Mrs. Maxine Blake Hilton.
Good evening, everyone. Thank you, Tamika. You're hearing me clear, right?
Yes, I can hear you.
Right, great. So let me add my voice in saying welcome to our webinar. And thank you for joining, because we know that persons have competing activities and could be otherwise engaged. So thank you for joining. And today we will be talking a little bit about mental health, breaking the stigma around mental health. So you belong here, your experience is valid, and participation in this webinar is always a choice. And so we want to have a little bit of a shared agreement to reassure you that you are in a safe space and you share at your comfort. You are allowed, or you should feel comfortable to pass or to pause or to step out whenever you need. We You should also try to listen to understand, and we all try to listen to understand and make room for different experiences and different perspectives. We respect privacy, so take the learning with you. And if persons happen to share their personal stories, please leave the stories here, but take the learning with you. So we want you to also to choose curiosity over judgment and ask thoughtful questions and avoid assumptions. And all questions are, we'll try to answer your questions as much as we can. And just a reminder, this session is educational, and please seek professional support if the conversation brings up distress. So wanted to add that for persons, so we're sensitive to persons' feelings and what you might be going through. Right? So I'll start here by asking, what have you heard? We are in the Caribbean and we have heard a number of things. Some of them facts, some might be a myth. So I'm going to ask a question and you'll indicate, please, by a show of hand, if you think the question I'm asking, is it a myth, is it a fact, or not sure? But I'll ask the myth first. So mental health problems are a sign of weakness. Is this a myth? So if you believe it's a myth, please show your hand.
I see one show of hand.
Okay.
Go ahead, Georgia.
Show of
No,
hands.
it's to respond to she don't have to talk. It's just to respond to if they think it's a myth or if they think what I read is a myth.
Got it.
Right. So no, anybody think it's a fact? You can lower your hand for persons who voted for myth. Anybody think it's a fact?
No show of hands.
Anybody not sure? All right, so yes, it's a myth. Mental health problems are not signs of weakness. The other question, no, not question, but comment. Young people can experience serious distress. Is this a myth? So young people can experience serious distress. Is this a myth?
No show of hands.
Is this a fact? Let's see, one, see two hands, yes, three, yeah. All right, great.
Thumbs up.
So it's definitely a fact. Talking about a problem always makes it worse. Is this a myth? See the hands going up.
There was a thumbs up.
Okay. Is this a fact? Talking about a problem always makes it worse. Somebody says a fact?
No show of hands.
Okay. So, of course, this is a myth. Support, so the last one, support and treatment can help people recover. Is this a myth? Is it a fact? All right. All right. So yes, we are getting somewhere. Thanks for the participation. All right. So this afternoon we want to cover to understand stigma and why it hurts. To understand why stigma around mental health exists, also to understand the cost of stigma, because everything comes at a cost and stigma has a high price. and identify and learn how to respond to stigmatizing attitude and statement. These are our main objectives for the afternoon. And I want to, from early on, just to define, according to the World Health Organization, define what is health. So according to the WHO, health is a state of complete physical, mental, and social well-being, and not merely the absence of an infirmity. So if you notice, it covers mental, it covers physical, it covers social well-being. And so WHO definition supports the message that mental health is an essential part of our overall health, because the definition singles it out. And this definition was adopted from 1948 and emphasized that health is holistic. It includes physical, of course, as we mentioned, the body function and the physical conditions, your mental well-being, your emotional and psychological well-being, and of course, your social well-being. Human beings are social by nature. So human beings need a supportive relationship, social connections. And so the definition of health encompasses all of that. So as said, mental health is a part of health. Everyone has mental health just as everyone has physical health. And mental health is on a continuum just as physical health. Not because you're physically healthy now means that you'll be physically healthy for the rest of your life, or not because you're mentally healthy now mean that you'll be mentally healthy for the rest of your life, or vice versa. Not because you're physically ill now mean that you'll be physically ill for the rest of your life, just as mental health. So mental health is how we think, how we focus, decisions, our beliefs, how we connect, relationships and belonging, how we feel emotionally, and how we handle stress, how we cope with life challenges. That is what mental health encompasses. So a mental health condition is not a moral failure. It is not a weakness, or it's not an identity. So a person who has a mental health challenge should not be known by the challenge. It's a person with a disorder or with a mental health condition, just as how a person can be diabetic. The person is not a diabetic person, but a person living with diabetes. So it is basically the same thing. So a diagnosis is not your identity. Or if a person is diagnosed with a mental illness, it's not their identity any at all. So because we're talking about stigma, we want to define stigma to say, how do we understand stigma? So stigma is a health-related stigma refers to a negative social association. So there's nothing positive about stigma. It's a negative social association attached to individuals or groups because of an actual or sometimes perceived health condition. So a person might be acting differently from you or differently from someone else. And because the person is acting differently, whether by maybe culture or whether by upbringing or something just happened and the person is acting a certain way, that the person might be perceived as having a mental health challenge, and then a stigma is attached to the person. So it's not only actual but perceived condition. And of course, once it's happened, there might be stereotyping, labeling, discrimination, social exclusion, or loss of status. So stigma basically is a negative belief plus discrimination about the mental illness. And I always say, because I've worked in the mental health field and I've worked in HIV field, and I always say that these are the two conditions that persons are labeled as their condition. There's no other condition I can think of the top of my head that persons are labeled based on the condition that they have. So the person not going to say a hypertensive man or a diabetic man or a diabetic woman, they're going to say, but they will say a HIV positive person or a mentally ill person. So the illness is not the person, and we need to differentiate that, because as I said, mental health is on a continuum, and nobody knows what tomorrow will hold for them. So stigma I want to differentiate stigma versus discrimination. So stigma concerns the negative, the attitudes, the belief, the stereotypes, the labels, and the social devaluation. So you take away the person's social value. Whilst discrimination is the behavior or the action that may result from stigma. So the stigma is a belief. So you believe something and you act on it. So you discriminate. You believe something that this person is gonna hit you because you think the person has a mental health condition, and so you act on it. You become violent to the person before the person, or you think the person gonna become violent towards you, and so the person is treated unfairly or they are denied opportunities. So I want to differentiate with the stigma versus the discrimination. So why does stigma exist? Sometimes it's lack of knowledge. Most times we fear what we don't know. So we'll see somebody going through a challenge that we can't identify with or we refuse to identify with, and out of fear, we act. So because of lack of knowledge, and of course, sometimes the media help to portray this kind of the stigma, because when they talk about mental illness in the movies or or the social media, it speak about violence, or the person is violent, or the person is just not 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 um not somebody you can talk to. And so this helped to drive the stigma. Also cultural beliefs, and especially in the Caribbean, we are very religious, and sometimes a person might go into a challenge and the first thing is to say, pray it away, or be strong. Don't air your dirty laundry, right? And then there's a misconception that think it's a choice or character flaw. Well, that person must be weak, that is why they are mentally ill. No, it's not a character flaw, and it's not by choice. Just as so if a person break the leg, you're not gonna say, just walk it off. The person come to you with a broken leg, can you say to the person, just walk it off? So if a person comes to you in going through some depressive a challenge or going through depression, you should not say, I shouldn't say can't, but you should not say, just cheer up. It's not as simple as that. And just as how the person who have a broken leg can't walk, it's just a person who's going through depression can't function as they used to or should. All right, so according to on our REACH project, now we have 3 levels of stigma. You have the community stigma, you have the health system stigma, you have the individual stigma. So the community stigma, it's basically geared towards, it's a group of people, not necessarily live in the same community, but community meaning wherever the person socialize. So that community now have stigmatized behavior towards the adolescent, sometimes towards even adult. If the person is going for sexual reproductive health services at adolescent, sometimes they are stigmatized by the community. So once they go to the clinic or once they go to a certain area in the clinic, they are said, oh, that little child is having sex and that little child is going to seek a family planning method. Just like with mental health, the person going to a mental health clinic, oh, that person is quote unquote mad in our Jamaican or Caribbean settings, right? And so the person is stigmatized from the community level. Then, of course, they have the health system stigma. The person is not offered the care as like everybody else. So that is a stigma. And then because if you as an individual know you're faced with community stigma, you're faced with the health system stigma, so you start to internalize these things. So what is wrong with me? Something is wrong with me. So your narrative, your internal dialogue to yourself changes. And so you're saying, okay, I must be a bad person, or something is really wrong with me because everybody think this about me, so it must be a fact. So you understand how the community and the health system and all the systems around us can drive a person to stigmatize themselves. Not because they want to, but because if they're living it daily, then of course they're going to believe it. Sorry. All right. So what stigma does is not only a word. It's shape your choices. It also affect the opportunities that you get in life, and it also affect your safety. As mentioned before, persons who believe that a person is mentally ill, sometimes they'll attack them because out of fear or out of just being ridiculed or out of just showing the stigma because they're in a group. And sometimes when a person in a group, they react differently than if you see the individual. So stigma does affect an individual, and public stigma, self-stigma, structural stigma, all affect the individual. And of course, if I am affected by this stigma, to protect myself, I might remain silent. To protect myself, I might not access care. And therefore, instead of getting help, my condition will worsen. Instead of getting help, I feel excluded and my condition will get worse. All right. So stigma does affect the individual and affect the individual on different and varying levels. Right. And of course, as I mentioned before, stigma come at a cost. It's a cost. When we stay silent, people get hurt. And anecdotal evidence shows that people with mental illness don't seek help due to stigma. So if I know, as I mentioned before, I will be stigmatized. Remember now, I might not be stigmatized in the health system, but then I'm living in the community and I'm stigmatized. I don't want to go forward, right? Because I have my internal stigma and I have this fear of seeking help. And therefore, my condition might get worse by staying silent. Delayed treatment also, as said, the problem get worse. I might be isolated. I might lose my job. I might become a school dropout because of the stigma. It's not only because of the illness or the condition. No, it's about the stigma that is displayed, and I'm not comfortable with it, and I'm stigmatized, and I know how self-stigma, so I am not going to go forward. I might even don't go to work. And then nobody at work will ask for me because I guess persons out of fear say, okay, it's best not to deal with her because no, she is quote unquote suffering a mental illness. And of course, in Jamaica, and I'm assuming for the rest of the Caribbean, madness label stops you from accessing care. Because once you go to the mental health clinic, once you go to a certain section of a hospital, you are labeled as mad. And even if your condition, you're going through a break, and your condition, you're stabilized, and you can perform beautiful like anybody else, that label remains. And sometimes, sadly, it remains for life. So stigma, it's really costly to the individual, to a productive individual, to to the general public, and even to the country. Because if a person can't earn, then they're not productive to their country or to their family. So we have to now think of how can we minimize stigma that persons can live their wholesome and fulsome life. And sometimes you will hear language like this. So stigma will show up in some subtle ways, especially for, say, an adolescent girl. She's going through a series of things. She might be depressed or she might be going through an anxiety situation. And the first thing is that she's just dramatic. Leave her alone. She's just dramatic. So she's not given the help or the support that she needs because she's now labeled as dramatic. In the workplace, they might withhold promotion because they have anxiety or they have a history of mental illness. So the belief is that because they have anxiety or the person have a history of mental illness, they can't function as other persons. And of course, the bullying and name calling, because of course, out of fear, what we don't know, we are fearful of, and sometimes they bully the persons or they call them names, and sometimes they are very derogatory names. And of course, sometimes teacher or even your parents might say, stop being so sensitive, instead of asking the requisite questions or trying to identify what is going on. And of course, if you're going to be ridiculed, if you're going to be bullied, or if you're going to be criticized, then of course you're going to hide your struggles until a crisis might occur. So just to emphasize here that words can wound or they can be welcoming. So I implore everyone on this call to try language that protects dignity and open a door. Open a door for the person to feel welcome to, to express themselves. So instead of you're crazy, and sometimes we have to check ourselves too, because sometimes we will say these things because it becomes the norm. It becomes a norm to say these words, and we might not be aware of how hurtful they are. Because can you imagine somebody who has gone through a mental health break? You probably didn't know, but the person know that, and because of the stigma, the person is very wary, and they come to you with something and say you're crazy. You might just trigger something, right? So be careful of our words. Sometimes we use it innocently and it hurts. So you're crazy. Instead of saying you're crazy, try you seem to be going through a lot. So right then and there, you open a door for further conversation. Somebody might say, just get over it. Try, I'm here. What would help right now? Just as the example I mentioned earlier, you can't tell a person with a broken leg to just get up and walk it off. So why should a person with a mental health challenge at any given time just get over it? Some persons, and this is also especially for the adolescent, oh, they're just attention seeking. How do you know that? Why did you assume that? Right? Try this behavior may be a signal of distress. The person is crying out for help. So see it as that and try to help the person. Or if you can't help the person, point them in a direction where they can get help. Or you can say that person is mentally ill, or the other derogatory word that persons use. But you could also say that person is living with a mental health condition. Just as some person is living with hypertension, living with diabetes, living with a heart condition, the person is living with a mental health condition, and if treated properly and if given the right support, they can be functional and can be a productive person in society. So please practice, rewrite or rethink one phrase you have heard and you have innocently sometimes used in the past. Rethink it. And sometimes you might say it in joke, but the person who you're talking to might not take it as a joke based on their previous experiences. All right, so stigma, there is some data here because it matters and it shows that it matters and it comes up in the numbers. Adolescence is a formative period and early support can change a life. The earlier support you give an adolescent can change their entire life trajectory. And as stated here, 1 in 7 young people aged 10 to 19 globally experience a mental health condition. Right? 15% of the global burden of disease in this age group is linked to mental disorders. So if you can imagine the population globally, then you know that 15% is significant. Suicide is a third leading cause of death among ages 15 to 29 globally. So can you imagine if the person was able to get the support that they needed, we could have more than likely prevented some of these suicide attempts or some of these successful suicide. So stigma affects readiness to seek help and delay sometimes danger. So it's important to have supportive families, supportive schools, and community to protect the person's well-being. Adults too experience stigma. And the stats here says that 48% of persons who have mental health challenges worry that colleagues would judge them for sharing their own mental health struggles. Almost 50%. 43% fear disclosure of a mental health condition could negatively affect them at work. And these fears, based on our social structure, they are real. They're real fear. Because some person really do experience, if they disclose their mental health status, they might lose their job. 70+% of people with mental illness globally receive no mental health treatment, either because out of fear, they don't want to go forward, or because they're treated differently, or because it's not identified as it should. So speaking openly matters. if you want to break stigma, speak openly with respect. At work, hide and diagnose our body in time off because of fear of judgment. This is how it shows up at work. In families, being told to toughen up, pray about it, or keep personal struggles private. We don't want everybody to know our family business. And I'm sure in the Caribbean context, we hear that a lot. Keep everything private. And so when it becomes public, it's when it's out of control. Right? Having emotional or physical concerns are minimized because of mental health label. And within oneself, believing that you need counseling means weakness or personal failure. Some persons really want to seek help, but because of the stigma, they stay away. Because of the stigma, they tough it out or turn to somebody who might not have the necessary skills because they don't want to be known that they are seeking a mental health service. So we need to, each person on here should try to break this kind of, stigma, speak about it openly with respect, as said. So I'd like, and I hope you can see this clearly, look a bit small to me, but I hope you can see it clearly. So here is a response that you can use, the listen response. And you don't need to be a therapist to offer a little safe space, right? And the L in listen stands for look for a private, calm moment. So if a person is going through a stressor and the person is acting boisterous, wait a little while and look for a private, calm moment. You're going to invite the conversation. How are you? And don't ask the person the question if you don't have time to respond. Don't ask and keep walking. How are you? How are you today? No. How are you really? And you pause and you listen, right? To invite the conversation. S stands for stay present and listen without fixing. Sometimes a person only needs to talk. They don't need you to try to fix the problem right away or try to fix the challenge they're having. Stay present and listen without fixing. Take it seriously, of course. Thank them for telling you. Sometimes the person have this burden to talk and they're searching for somebody to talk to. And they finally talk to somebody and the person is not. And can you imagine now they are not taken seriously? So take it seriously. Thank them for telling you. It's a burden and they have been sharing it with you and they chose you to share it with. Thank them for telling you. Then the E stands for encourage trusted and professional support. So you're not a therapist, but you offer a listening ear and you encourage trusted and professional support. You can probably, if you have a time, or you can walk the person to or tell them where to go and see to that they go to it. And then the next step is follow up and act if safety is at risk. So please follow up. Don't tell the person to go somewhere and you don't do any follow up. Follow up to say, did you get to go? And of course, ensure that the person's safety is at risk. Right? And sometimes supportive conversation can be like this. I've noticed you haven't seen like yourself lately. Or reassure the person, you are not a burden. So these small phrases can reduce the stigma, tell the person, oh, it's okay to feel the way they're feeling. Or would you like me to listen or help you find options? Or we can contact someone together because sometimes the person want to seek help but don't want to go alone because of the stigma too. So we can contact someone together and you don't want to take over the person's life either. So make it a shared responsibility. And of course, leave the door open. I will check in again tomorrow. So avoid comparison. Why you think you alone feel so? Lord, no. Avoid comparison. Avoid minimizing. Avoid the gossip. And please do not force a person to disclose the entire story. They don't have to relive the entire story for you to help them. Right? Also of note and of importance here is to know when safety may be at risk. Sometimes the persons are bawling out for help, know when to try to identify when they're at risk. You're probably not a clinician or mental health personnel, but ask directly, are you thinking about hurting yourself or ending your life? And asking directly does not encourage suicide. Hmm? You're not putting the idea in the person's head because if the person is thinking about it, it's already in their head, right? So you're offering it to create opportunity for honest support. And of course, if the answer to number one is yes, stay. Do not leave the person alone if danger may be immediate. And of course, you're going to try to connect the person, contact a trusted adult, crisis line, health professional, or emergency service, and move away from immediate hazard when it's safe to do so. And of course, follow up. Don't leave the person high and dry. Follow up. Keep checking up after the immediate crisis. And often note here in the highlights in red, do not promise secrecy when someone may be unsafe. Do not say to somebody, it's a secret. I won't tell anybody. If the person's life is at risk, or if the person is thinking of harming others, if it's not a secret, you have to tell somebody who is trusted. We are here to preserve life and to make sure persons can live their best life. So everyday way to protect mental health, you connect. Try to keep connected. One safe person, one safe peer, family, a mentor. So try to connect with somebody to preserve your mental health. No man is an island, no man stands alone. So try to have somebody who you can connect with. Move, keep yourself moving. Walk, you stretch, sport, and dance. Even if you can't dance good, just keep moving, keep dancing, and stretch. Of course, you need your adequate rest, regular sleep, and your screen boundaries. Young people and everybody, and I'm preaching to myself too, screen boundaries and regular sleep. And of course, the body is made to reset. You reset your body by sleeping, regular sleep. You reset by doing your slow breathing, your deep breathing exercise. If your prayer, if you're a praying person, your self-reflection, your grounding exercises, and hopefully we can go through grounding exercises in other webinars so we can teach you skills on how to reset. Of course, express yourself. If you're not able to express yourself by telling a person about your challenge, use a journaling, use artwork, music, have a healthy conversation. But sometimes if the avenue is not there for a healthy conversation, journaling is good, artwork is good, music is good. And of course, get help from a counselor, doctor, from your clinic, from a trusted adult, but try to get help. No man is an island. So I'm going to ask each person on this webinar to choose one realistic action for this week. Which one is realistic for you? Maybe it's regular sleep. Maybe it's to reset, do your deep breathing. Maybe it's to improve your your praying habits, or start dancing. But try to choose one realistic action for this week. So we want to emphasize that a community can break the stigma. We normalize, includes mental health in ordinary health conversation, especially for healthcare workers. Sometimes we ask about the physical health, we ask about the children, we ask about everything else apart from the person's mental health. So include mental health talk in all our health conversations. Of course, education go a far way because remember we mentioned that stigma is also driven by lack of education and lack and fear, and fears because of lack of knowledge sometimes. So correct myths with accurate, respectful information. So if you hear a myth, don't correct the person out loud or to embarrass the person, but you can correct respectfully and give the the adequate information. Invite people in challenge, teasing, and discrimination. So invite people in. Sorry, I read it wrong. Invite people in, and you're going to challenge your teasing and discrimination, right? So don't be a silent bystander because silence encourages stigma. Being silent encourages stigma. So challenge teasing and discrimination, and you don't have to challenge it in a boisterous manner or in a violent manner to escalate the situation, but challenge teasing, and discrimination. So you can also connect no referral pathways and make warm introductions. So as healthcare workers too, or as community leaders, or as even as school leaders, and some adolescents they're active in their youth groups, no referral pathway, no somewhere to refer somebody if they come to you with a mental health challenge that you don't have the resource to deal with. And of course, model the behavior, model how you speak to persons and helping persons to seek help, right? And create confidential, youth-friendly spaces and procedures. So this is with the community, this is with the schools, the health facilities, and even the home, create confidential, youth-friendly spaces and procedures. So this is a discussion question, but I'm going to open for discussion just food for thought. What is one barrier we can remove locally? Just think about that. What is one barrier you can remove locally? And so that to help persons to help to break the stigma and to encourage persons to talk. What is one barrier we can remove locally? And at an individual level now, be an upstander, not a bystander. Right? So be an upstander meaning that you challenge the stigmatizing behavior or the discrimination. You challenge it, not a bystander. So challenging joke, you could say to the person who's making a joke on somebody, that's not funny. Right? So you challenge that. Don't allow the person to continue to ridicule the person. That's not funny. And you can check in. How are you really? And remember, when you ask, as emphasized before, you ask and you wait. You don't ask and move on. And of course, model self-care. It's okay to take a mental health day, right? So if you are in charge of an organization or if you're in charge of a grouping, it's okay to take a mental health day. Say to the persons who you lead, or say to the persons who you supervise, it's okay to take a mental health day, right? And remember that stigma dies when we start talking. Stigma, if we are bystander, we allow things to happen, and then when it reach a crisis proportion, that's when we step in. No, we're going to circumvent that crisis. And a lot of persons, and I'm not going to say a lot of persons, I'm pointing a finger because I'm guilty. Sometimes we don't step in when we should, and then it reach a crisis proportion, or we just stay silent and say, oh, I'm not the one ridiculing the person, or I'm not the one saying this, but then you remain silent. And silence, when you remain silent, you encourage your behavior. So our key messages: mental health is a part of health. Mental health is not by itself or a vacuum. We're a whole being. And if you look back at the definition of health, it talks about your mental health, it speaks about your social well-being, and it speaks about your physical health. And just as how your physical health can deteriorate, your mental health can deteriorate. And just as how your social well-being can deteriorate, your mental health can deteriorate. And a person is more than a diagnosis or a difficult moment. So if a person is going through a difficult moment or have a mental health condition diagnosis, the person is much more than that. The person is a gifted person. The person is a mother. The person can be a father. The person is a daughter, a brother. The person is a valued member of the community. So therefore, the diagnosis is more than the person. And of course, as I can't overemphasize, that stigma grows in silence. Once you're silent, the stigma will grow and the person becomes stereotyped and persons are excluded and sometimes the stigma is not even, or it's a perception, it's not even real. And so the person is stereotyped and they're excluded. And remember, if you look at the definition for health, it includes social well-being. So can you imagine if a person is excluded from the social well-being, then of course they are not healthy because the definition of health includes mental, physical, and social. Also remember that listening without judgment can open the door to help. right? Sometimes person just want to listen ear and not wanting to hear that, to tell you to fix the challenge for them, but just to listen. And it open the door. A person can know that, okay, when I'm having a challenge, this is a person, this is a safe space, this is a person I can go to. And safety concern require immediate trusted support. So once you have any idea that the person might be at risk to self and or other, you know need to act and to ensure that you don't tell the person it's a secret, but you act in the person's best interest and in the interest of others by get trusted support and getting the person to help and not leaving the person alone. And one caring conversation can be a turning point. You can imagine somebody going through a crisis and they have been talking to other persons and not getting that support. And they finally come to you. You might be at the end of the line when they say, you know what, I'll let me make this one try, and you make a difference. You can imagine how that can impact or make a turning point in the person's life, right? And these are some references. And of note here, there is one that I wanted to talk about, to bring attention to. UNICEF Caribbean, Eastern Caribbean, Young Caribbean Minds, youngcaribbeanminds.com. I've been on it and there are a lot of resources there. So if you're having a challenge or if you want to further educate yourself or to further have other resources to help others or just for yourself, you can visit this site. It's youngcaribbeanminds.com. So please, after today, make mental health not a taboo. It's human to have a break. It's human to have, you can be going about your business and have, you get, and you fall down and your foot break, right? Just the same way you can be going about your business and something happen and you have a mental health break. So please, let's break the silence and build our support and let us save lives. And I'll pause here for questions. Over to you, Tamika.
Wonderful. Thank you so much, Mrs. Blake Hilton. An awesome presentation. We want to open up the floor at this time for any questions, or if there is anyone that would want to share anything regarding the topic, you're free to do so at this time.
Good evening, everyone, and thank you for joining tonight. Currently, we have one question in the chat, and it reads, "Hi, Maxine. Can you elaborate on the best way to support someone who is suffering from a mental health illness but believes they are fine? In brackets, denial."
Thanks for that question. So let me repeat. So it's the best way to support someone who who you think has a mental health challenge, but the person is saying that they don't have a mental health challenge. Did I get
Yes,
that correctly?
correct.
All right, sure. All right. So firstly, it depends on the relationship you have with the person. So you have to have that kind of relationship with the person because remember, if you're coming from a stigmatized, say for example, the person is stigmatized, then the person don't trust people now, right? So you have to know, see, what kind of relationship do you have with this individual? And if the relationship is not good or is not a trusting relationship, you might want to ask for outside help, right? Ask for outside help for somebody to step in to talk to the person or ask the person if they need help. So the person might think that they don't have, or you quote unquote, the person is in denial. How do you know the person is in denial? That's another thing, right? So it's not easy. Because of course, if the person have certain mental health condition and it's not untreated, then they too they're not trusting of individuals, and especially from the period, if they had previous experience. So is now to refer the person and you, the individual, not act as if you have the answer for the person, or you know definitely the person's in denial. So is to refer the person, I would say refer the person, or to at least start that initial conversation and hear what you say to the person. Be very supportive, be very empathetic, and then that is not welcome, then of course seek other sources of help for the individual. I hope that helped.
Yes,
Thank
it
you so
did. Thank
much.
you.
Sure.
We also have another question in the question box. It reads, do you treat adults differently from children when providing counseling support?
Yes, definitely, because it depends on the age of the child. Some children, they are not able, all right, you wouldn't want to have a child sitting in front of you, say, for example, a 4-year-old or a 6-year-old, and you're gonna do only talk therapy. The child might not respond to that, or the child might just respond yes, no, or not respond at all. But if you include play therapy, because a child normally, how they interact with the world is by play. So if you have a play therapist, can interact with the child and you'll get that child either talking. What I find work is puppetry. So you play acting and you'll get the child to be comfortable, number one, and number two, to play act out what's happening. An adult, on the other hand, talk therapy might be good, and of course, they have different modalities of talk therapy. So the therapist will know, based on the initial assessment, which talk therapy or which kind of psychotherapy is best for that client. But also, adults can benefit from play therapy because sometimes play therapy is what we call a projective. So what's in the mind sometimes comes out in the play. So sometimes a person might not be comfortable talking about something, but when you have some projective techniques, it comes out in what the person is going through can come out in that kind of therapy.
Thank you
But it
for
all
that
depends on the
detailed
child.
response.
Sure, sure.
Thank you, Maxine. We have one question again in the chat, and it reads, how can we identify that a person is having mental health issues?
All right. So we have to be careful here because we don't want to stigmatize a person. We don't know exactly what is going on. So the best thing is to ask an open-ended question. How are you doing? How are you today? Do you want someone to talk to? Because you yourself, if you don't have the necessary requisite skills, cannot identify that the person is having a mental health challenge. And sometimes we left with a perception which might not be true. So the best thing is to ask a person, do you want someone to talk to? Or to find out, and if they want someone to talk and you can provide that kind of safe space, then they might talk and then you can pick up that, hey, something is wrong and you can't want to refer the person. But it is challenging, and I would refrain from persons just saying, all right, if they're having X, Y, Z, then they must be going through a mental health challenge. No, it's not as simple as that. All right. Hope that
Thank you
answers
for
the
that
question.
response.
Yeah.
I hope so too. I believe at this time that would be all the questions. If anyone has any additional questions, we invite you to share it now.
So let me ask a question. So if they don't have any other question, they're thinking about it. After today's session, anyone can raise a hand and answer. Have you learned anything, and do you think this will change how you view mental health, how you view what you say? And is there anything that you would want to change? If you don't want to answer, you can type it in the chat.
We have a response in the chat which says definitely more cautious in certain areas.
And sometimes if we're not sure, we seek help for us. There's nothing wrong in seeking help to say to a healthcare worker, I've seen somebody's behaving this way. How do you think I should approach this situation? Better to ask than to err, right? Because you could be doing more harm than good. So it's better to ask how to help someone instead of just offering help if you don't have that skill. And of course, somebody says it's important to observe before asking. Yes.
All right. Do we have any other questions in the chat? Or anyone else would like to share anything before we wrap up with this evening session?
There's a comment there to say that sometimes we think people are having a mental breakdown, but they may only be having a bad day. And that is so true. That's why it's important to ask respectfully and to respect the person's, boundaries. Not because you think that somebody is going through a challenge me that you have to jump in. None of us have this S on our chest to say we're a Superman to solve everybody's problem. So it's just to maintain the person's dignity, create boundary, and to ask in a respectful manner, if so, or to ask somebody else to ask.
That's very true. Very true. Mrs. Becky Hilton. All right. We're gonna be closing out at this time if there is no further question or no other feedback in the chat. And so as we bring this webinar this evening to a close, I want to extend a sincere appreciation to our facilitator, Mrs. Maxine Blake Hilton, for sharing her expertise, her experience, and valuable insights with us. I'm sure all participants on will agree that it has been a wonderful webinar. And so to our returning participants, thank you for continuing this journey with us. We also want to say a special thank you to those who would have joined the Reach webinar series for the very first time. We hope that you found this session informative. We hope that it was practical and relevant to your work and communities. We are grateful for your active participation throughout the question and reflection and your willingness to engage in these important conversations. Your contributions helped to make tonight's session both meaningful and successful. As the webinar series continues, we encourage you to remain engaged, share the information and lessons learned with your colleagues and the network. Please join us for our upcoming session on August 18th, where we will discuss adolescence and healthy lifestyle, nutrition, and mental health. If you would have missed any of our sessions and you would like to re-listen, or if it is that you'd like to re-listen to any of them, please do check the chat for registration link and recordings from our previous sessions. And so on behalf of the Reach Project team and our partners, thank you once again for spending your evening with us and for your continued commitment to improving adolescents' health and well-being across the OECS. We wish you a wonderful evening. Please stay safe, and we look forward to welcoming you again to our next webinar session on July 18th. Thank you so much. Have a wonderful evening.
Thank you all for listening. It was a pleasure.